Tim, we're live.
We're live. Good morning and welcome to today's meeting of the Public Health and Prevention Cabinet Panel. Before we move on, I have an announcement which I need to read out. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of this meeting are asked to keep the microphones and cameras switched off until called upon to speak, and to switch their microphone and cameras off once they have done so. To indicate a wish to speak, members should request to do so using the meeting chat function. At the end of the debate on each item of business, there will be a vote. Members should vote using the meeting chat function by indicating for, against, or abstain. I will declare the result after each vote. Officers are in attendance, but will keep their cameras and microphones switched off unless called upon to speak. Breaks will be incorporated into the meeting as appropriate. Given the length of this one, I hope that's not required. In terms of substitution, I want to welcome Jonathan Kay to the meeting, who's substituting for Fiona Guest, who sent her apologies. I also have apologies for Margaret Eames Peterson. And now at this stage, I'm going to ask each member of the panel to introduce themselves, and I'll do so in alphabetical order. Councillor Brewster.
Thank you, Chair. Yes, Councillor Annie Brewster, Conservative Member for Harpenden Rural, Deputy Executive Member of Public Health and Prevention and Vice Chair of this panel.
Thank you. Councillor Chesterman.
Good morning, I'm Councillor Lynn Chesterman and I am the Labour spokesperson for Public Health and represent Welwyn Garden City South. Thank you.
Thank you, Lynn. Councillor Clapper.
Thank you, Chair. Good morning. My name is Caroline Clapper. I am the Conservative Councillor representing Watling Division, and I'm also a member of this panel. Thank you.
Thank you. Councillor Gordon.
Good morning. I'm Susie Gordon, Councillor Susie Gordon. I represent Hatfield East for the Conservatives, and I'm also Vice Chairman of the County Council.
Councillor Howard.
Good morning. I'm Tina Howard. I'm the representative for Hemel Hempstead South East, a Conservative.
Thank you. Councillor Kay.
Hello, Councillor Jonathan Kay. I'm Conservative Councillor for Ware South.
Thank you. Councillor Mills Bishop.
Good morning, Mr. Chairman. Good morning. Mark Mills Bishop, for President and Chelmsford.
Thank you. Councillor Rowlands. Oh, sorry, beg your pardon. Councillor Quinton.
Good morning, everybody. Nigel Quinton, Lib Dem spokesman on public health and representing Hanside and Pear Tree Division in Welwyn Garden City.
Thank you. Councillor Rowlands.
Thank you, Chair. Anthony Rowlands, Liberal Democrat member for St Albans East.
And Councillor Tyndall.
Ron Tyndall, a county councillor for Hemel Hempstead St Paul's, a Liberal Democrat.
And last but not least, Councillor Wyatt Lowe.
William Wyatt Lowe. I'm a county councillor for Hemel Hempstead Town, and I'm a Conservative.
Thank you, one and all. I'm not sure I even introduced myself there to the public. So I'm Councillor Tim Hutchings, Cabinet Member for Public Health and Prevention, representing Hoddesdon North. Thank you, one and all. Members' interests. A reminder of disclosable pecuniary interest. Does anyone have anything to declare? Can you switch your screen off, please, William?
Sorry.
I'll take that. Thank you very much for that. Moving on to the minutes of the last meeting on the 6th of February, before all this nonsense started. What a long time ago. The panel's invited to note the minutes of the last meeting. Are we happy to note them?
Agreed.
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 Brilliant. I think we can take that as agreed in that case. Thank you very much. We have no public petitions, so I'm going to move on to the main items of the agenda, starting with approval of the Hertfordshire County Council smoke-free policy and toolkit, and invite Liz Fisher, who's Head of Provider Services, to introduce the subject. Over to you, Liz.
Good morning, Tim and everyone. Hello. As you know, we've done a huge amount across the county in reducing smoking prevalence, particularly in our more deprived communities, and that continues to make good progress. The background to this is a year ago in July 2019, panel asked Cabinet to approve that we worked towards the County Council becoming totally smoke-free. This is now the follow-on from that, and how we plan to become smoke-free from the 1st of January, with your permission to ask Cabinet to do so. You've had the relevant papers, but just to emphasise that we've come to the position of going totally smoke-free based on a huge amount of work and an implementation group with representation from all directorates of the council, the views of smokers, non-smokers, people who vape, and the results of a staff survey that was done earlier this year. The results of the staff survey were appended to the report, so you have that. And obviously there were mixed views, but the views of smokers were very well represented in that. And we've asked for allowances to be made for certain groups of staff, which wasn't what we originally intended. But the results of the survey showed that some staff groups, those who maybe have disabilities, or for whom it would be unsafe to go off-site to smoke during the night, for instance, that we have to have exemptions for those to be allowed to smoke in discrete areas on site, and also for some service users. So when we first planned the policy to go totally smoke-free, we now have to consider the needs of service users for whom it would be unsafe to go off-site. So, for instance, people with dementia or physical disabilities who need to be supervised. So we now have made exemptions to that policy and the ability for risk assessments to be done for different areas and individuals to that policy. So I'm not going to go on about it anymore, other than to say we've got facilities and management support in this, and that there's significant training plans and a huge communication plan. It's a positive step for the council, and it means that our leadership in tobacco control continues. Can I take questions in a second? I'm nearly there. And then we will be supporting staff to quit smoking, doing comms with Stoptober to make it easier for staff to quit, providing free support, free treatment, and free medication for staff. So the recommendation is that to ask Cabinet to approve this policy going forward. Thank you.
Thank you, Liz.
There are some questions. So.
Yes, I'm aware of that. First of all, I'd just like to thank you and your colleagues for the amount of work that's gone into this. It's over a long period. There's been a thorough consultation, and I think the measures that you're putting in place to introduce it, to support staff that need that support, are to be commended. So thank you for that. And you're right, there are a number of questions. First of all, I got Nigel Quinton.
Thank you, Chair. And yeah, I'd like to underline your comments back to Liz. I think it looks a very, very thorough piece of work, and congratulations for that. My question is only about the vaping side of this. Just a very quick question. In under 7.4, it wasn't very clear from the bullet point on vaping, safety vaping, what people were agreeing with or disagreeing, but clearly there are a variety of views there. My main question is just what is the safety aspect of vaping for co-workers, and whether that needs to be restricted in the same way as smoking at all, if there are no downsides to somebody having an e-cigarette close by from a health point of view. Is it any different to having a cup of coffee?
So in response, Nigel, it's not about the dangers of e-cigarette. There are very few exceptions where e-cigarettes would not be a recommended use. It's about etiquette, and it becomes a nuisance to other people. So it's not about restricting vaping because it's of any danger. It's because people who don't vape find the plumes of vape or water vapour a nuisance, and for some people they are irritated by the vapour and by the flavours and the smells. It's not about any dangers. It's just purely etiquette and what people want. They don't want to be around people who necessarily want to be around people who vape, which is why it's going to be restricted to certain areas, but to continue to be allowed on site, because we see it as a proactive measure to help people reduce smoking, stop smoking, and help them comply with the policy.
That's very helpful. Thank you very much. Yeah, I can see that, and yeah, thanks for clarifying.
Thank you, Nigel. Next question from Anthony Rowlands.
Thank you very much indeed, Tim, and I echo the remarks about the thoroughness of the report, and I'm very grateful for it. My question's, I suppose, about other public authorities, and recalling that when we've had previous reports about smoking, and indeed in this report there is reference to the connections between poor mental health and smoking. And I'm wondering, and I'm also looking and read through the section about our staff, and obviously there'll be particular groups of staff who have to go into homes as part of their work. And I'm thinking, for example, of adult care services. My question is, do you know what is the current approach, for example, from HPFT, the Hertfordshire Partnership Trust, Mental Health Trust, and is there an alignment, as it were, between what they do and what we're proposing to do?
Oh, absolutely. In fact, they beat us to it. They became smoke-free about 3 years ago. They were one of the first NHS trusts to become smoke-free. They are also working with us very closely to ensure their staff are trained to be able to provide help and support to service users to stop smoking. We always have work to do. We don't have probably a fair representation of people with mental health conditions who are referred to the service. It has been stalled during COVID because we haven't got access to and can't meet with staff within the Mental Health Trust in the same way. But we are working with them very closely, and they are very well aware of the importance of this for their service users.
Thank
you. Okay, Anthony. You mentioned other authorities as well. I'm sure Liz is far too modest to say, but we were in a webinar that she was speaking at a couple of months ago, and the authorities across the country, I think, were very respectful and expressing quite a lot of admiration for what she and her team were doing in the county. So I was very proud of that. I haven't got any other questions on my list here. And on that basis, I'm going to move to a vote. So can we all vote, please, for, against, or abstain? Well, there's a clear majority there, so thank you, panel. Thank you, Liz. And if we may, we'll invite you back perhaps 6 months into the new year, just to let us know how it's all going. Thank you.
Lovely. Thank you, Tim. Thank you, everyone.
Right, moving on. Item 4, we've got children's healthy weight procurement. Sue Matthews. Sue, are you with us? Oh, no.
I was supposed to message Tim before we finish. We've just finished rather quickly, so I'll quickly message her now. Or,
Okay, fair enough.
Or Alison can. All right, apologies.
All right. Is Bethan with us? No. Is Jim with us?
I am, Chair. Good morning.
Do you want to, with everyone's consent, I'll move on. Happy to move on to item 6 because I know Jim's got plenty to do today. So let's do that while we're waiting for the others to join us.
Okay, Chair. I'll just try and get the presentation to show on my slides if I can, which are. Sorry, I'm just having a little bit of technical issue because it's showing three presentations that I actually closed down. So apologies.
Sue, we'll put you back to the next item. We've just gone on to Jim for a moment, if that's okay.
Okay, great, thank you.
Sorry, apologies. Right. So I'm going to try and share my screen again, and hopefully that will come up. This was emailed to all members as well yesterday evening. Is that showing, Chair?
Yes, it is. Yeah.
Great. So the purpose of this item is to update members on the local outbreak plan, and although the plans have been through special cabinet panel, it hasn't been to this panel, and time has moved on since I drafted the original covering report, although the plan is still live in a living document. The first thing to say is that we have a number of different situations in the county. Because we're a large county, like most places, we have a number of different COVID situations, not just one. And our belief is that we have to be driven by the epidemiology very much and the data in terms of understanding the dynamics of each outbreak and each situation. So nationally, as members will be aware, we've seen a fairly large national rise driven partly by young people, but spreading into the community. We're also seeing this, unsurprisingly, in Hertfordshire, and the situation is changing rapidly, and I won't go over the government announcements yesterday. The local rise was mainly driven by young people. That's not to blame them, it's just a fact that you get people gathering in groups close to one another and the virus will spread. So I don't mean that in any sense pejoratively, and because our young people have been great through the first wave of this. Nationally, there is speculation about whether this is a second wave. We don't know. Technically, really, the first wave hasn't ended, so this is a surge. Whether it's a surge that can be contained or whether it will continue to climb, we don't at this stage know, so I'm not going to speculate. The infection numbers are rising in a number of districts. Some of them are just due to one or two families, so places like Stevenage, we've had a few families, not concerning. Members will know that we've had large increases in Watford, which are now declining, and I think we've very successfully managed the outbreak in Watford with partner agencies, especially the Borough Council. The same with Dacorum, actually, it's now stabilised, so I'm pleased to. That doesn't mean we ease off the measures, but we've got two large outbreaks under our belt, working with the Borough Councils in each of those areas. Hertsmere I'll come back to because that is rising. St Albans, there has been some speculation. It is very much possible to contain spread in St Albans. I think there are some small outbreaks and cases that we are dealing with, and so this idea that St Albans will be next after Hertfordshire, I think, is not borne out by the data yet. And in the Hertfordshire context, as we know, we had a number of cases linked to schools, started in the Jewish community, but is now not in the Jewish community. This is not a Jewish community issue, this is a broad community issue. There are cases of young people linked, and I think at the latest count we had 99 linked to socialising during the summer, not in school. I emphasise not in school, outside school, and we are working very strongly on that, taking a whole range of measures. The positivity rate in testing is high in Dacorum, in Hertfordshire as well, which is a sign that we need to act very robustly on this. And in Dacorum, the context is again younger people, but spread into some older adults. And while the positivity was high, the rate of numbers is declining. So it's a mixed picture. Like most of England, it's volatile, and we are responding to each outbreak and situation on its merits. I'm very pleased to say that I think we've got care home outbreaks under control. We haven't had any new care home outbreaks particularly in these areas, and obviously there are workplace situations continuing across the county, but nothing that is something we wouldn't expect. That doesn't mean we don't take it seriously. I'm just saying that our epidemiology hasn't gone wildly off where we think it should be. Just to share with you the rates. So the middle column of the incidence rate, the last 7 days is the one I tend to use, and you can see that in Hertfordshire as a whole, our incidence rate has gone up a little bit, but in a number of places it's gone up. In Hertfordshire it has gone up most. In a couple of places it's fairly stable actually. So you can't treat Hertfordshire as a whole. You have to respond district by district and situation by situation to this, which is complex, but I think with our district partners important. We have started what we call 8 sets of actions over.
Sorry to interrupt you.
Yeah, sorry, Chair.
I just think that might be a useful point just to ask questions to thus far. I know Caroline Clapper wanted to come in with a question.
I'm happy to do that.
Chair, I'm happy to wait until the end of Jim's presentation if it's easier. Very happy to wait.
Okay, fine. In that case, Jim, press on.
Okay, hopefully I won't bang on for more than another 10 minutes. Right, I won't go through all these slides. I'm sure you'll be relieved. We're taking 8 sets of actions in relation to Hertfordshire and Dacorum. The Watford actions we have done significantly. I have to say I do want to pay tribute to the faith communities, because the Hindu community and the Muslim community and the Jewish community have all worked very hard to make sure that religious festivals have come off very, very safely indeed, which is really good. And I mean, not to say the Christian community isn't, they obviously are, but they haven't had the same kind of significant festivals at this time of year that other faiths have, because we've just had Eid, we're about to have Jewish New Year, and we've had the pilgrimage to the Krishna temple in Hertfordshire, and they all thus far have gone off very safely. So our 8 sets of actions are preparing NHS capacity for surge, largely NHS 111 because we're seeing an increase in calls there. Really understanding the dynamics of the infection, so we do deep dives and case data. We actually have individual case data on people which we track and we do detailed reports on. Continuing the robust management of existing outbreaks through plans. So our schools plan, our care homes plan, our workplaces plan are all things we're kind of working on, because actually we need to continue the effort on those, because we don't want epidemics and outbreaks fueling one another or driving one another. Quite a lot of communications, I won't go in detail to, but we had boots on the ground over the weekend of people out talking to licensees and food venues. Every food business and licensee in Hertfordshire has been written to or is in the process of receiving it. A number have received personal visits. We've written to all parents. We will stand up the roadshow again this weekend in bits of Hertfordshire to engage with people about social distancing, and we've done targeted comms campaigns. I mean, our Muslim community leaders did targeted videos in community languages with communities as one example, and we produced materials in Polish as well. We're working on testing uptake in key populations, and we will, I believe, as of Monday, restart in Hertfordshire our locally commissioned testing for key workers, because we do need testing capacity. We've got some really good testing capacity in Hertfordshire, but there are a number of national issues in testing, and we are doing what we can to resolve those. Contact tracing is well underway. Local environmental health officers are doing masses of contact tracing. And what we are now doing is, if the national system can't contact people within 24 hours, we are taking over the cases locally, and we will be standing up a local call centre for contact tracing, so that we work very closely with the national contact tracing service. I've mentioned licensed venues. I have to say, where we have considered enforcement action, we've actually managed to do everything by consent so far. Which is really good. I'm quite pleased about. And in terms of unlawful events, you will know that the police managed to stop, I think, 2 unlawful raves. We now have a county-wide safety group that looks at the public health aspects of all large public gatherings. Our approach is to focus on COVID and the risk. So I'm pleased to say that the bulk of events have worked really well with us. So that's the kind of current situation update. Our focus, I think, remains the suppression and control of the virus as much as possible. 7 key themes of response plus prevention, and this brings us onto the local outbreak plan, and then I'll talk briefly about governance arrangements. So in late May, the government gave every upper tier local authority in England a month to write, create, publish and approve a local outbreak plan, and we did it. And government set 7 themes, which were care homes and schools, high-risk places, locations and communities, local testing capacity. Appreciate national testing capacity is still an issue. Contact tracing in complex settings, so that's where for example, types of settings like care homes with people with dementia or learning disabilities that you just can't do from a national call centre, but we've taken on a lot more. Data integration, and that has come on leaps and bounds, I think. Vulnerable people, so people very vulnerable to COVID. So members will be aware that the County Council with partners, districts and voluntary sector distributed over 100,000 food parcels during the first lockdown, and local boards. We know that what works in stopping COVID are the 3 headline things above at the top of the slide that we have, because we don't yet have a vaccine and we don't yet have antivirals that will prevent infection for mass use. So we're down to, hygiene, cleaning, disinfectant, physical distancing, disruption of the opportunities that the virus has to pass on. So, for example, our scheme on taxis in Hertfordshire, where we're subsidising perspex screens between driver and passenger, and we're also providing training on cleaning and safety for drivers and passengers. Testing, isolating and contact tracing remains hugely important for us, which is why we put so much effort into contact tracing. And there's a thing called case finding, which is proactive and more intensive than contact tracing, which we've done in some care homes where we found one person, so we've gone and tested cohorts to find people. That background, I think, gives us our grouping for our local outbreak plan, which is 5 big themes. So there's prevent and respond, which is all of the settings from care homes to vulnerable people. There's testing and contact tracing. So members will be aware that we actually set up our own swabbing cell and swabbing service for care homes and for outbreaks, and are setting up local contact tracing because we believe we need to do that to work and dovetail with what National does. Surveillance, intelligence and data. So we have a surveillance team. We have a daily surveillance meeting that looks at all the epidemiology in detail and then passes out tasks to the various cell groups and other groups. Engagement and communication, which is a board made up of the 11 leaders of all the councils. David Williams is chair, our chairman of this panel is deputy chair, and the Police and Crime Commissioner, and governance and coordination, which basically is a network of services and teams. And our outbreak plan is attempting to prevent the spread of infection, to identify outbreaks as early as possible and to contain and suppress them. And as I say, actually, it is local action led by the districts and the county and partners that have managed Watford and Dacorum. We've done that locally. I'll skip this slide if I may. We're looking at 4 levels of outbreak. So the first is outbreaks within existing capacity, even if they are in multiple settings simultaneously. And those are managed by what's called a Health Protection Board, which is an officer board, which I chair, which reports to the elected member board. These arrangements were ordered by government. I think we're still at number 1 currently. Level 2 is outbreaks which completely exceed our management capacity and need additional resource. So that's where we ask the Strategic Coordination Group of the Local Resilience Forum to provide resource and help and mutual aid. Bear in mind, we do have experience of doing, in one incident, screening over 1,500 people, and in another screening over 2,000. So we are quite good in this county at managing large situations. I think the third is outbreaks that exceed existing capacity and require a major incident. So that was probably the start of COVID earlier in the year, and the flu season 2017 were examples. And the final level 4 outbreak would be a second wave as bad or worse, or an upsurge of the first wave as bad or worse than the peak of the first, which requires full coordination and a big national response. Now, I think we're still at the upper reaches of level 1 outbreaks. So we are managing this proactively across the county. This is a really nice, simple little diagram of the networks of people. So you can see in the middle the kind of blue blob called the Health Protection Board. And we have an elected member engagement board. There are reporting lines up into the Public Health England Regional Hub and the Joint Biosecurity Centre and NHS Test and Trace. There's a reporting line into the Strategic Coordinating Group of the Hearts Resilience Forum and into individual agencies, because each person takes that back. And then we have those 5 big groups of activity, the 5 themes that report in. So, for example, you'll have seen the work that's being done on care homes. That's one of the themes of the plan. We've also got a BAME plan underway that has. We're working with BAME communities, so there are fortnightly meetings with BAME communities. The taxi drivers programme was one part of that, but there's 4 bits to that, which I won't go into detail on. But, you know, risk assessment of staff and situations, ensure the outbreak plan fully considers BAME populations, community language resources. We had another meeting this week where we agreed to do more on that. High risk reduction 5-point plan that I won't go into detail on, but you know, there are a number of things we're working on there, including getting GPs to make sure the BAME patients at high risk of severe disease have got the best health they can, and co-creating a BAME network to work long-term on health inequalities. Big public information campaign that you may have seen. It's been all over the county. It's also been very targeted with people. We're asking people to do 4 simple things to play your part. We'll be launching more stuff this week. We launched more stuff last week, targeted at young people and targeted at bits of the county. But the play your part is washing your hands, keeping your distance, wearing face coverings, and isolating and getting tested if you develop symptoms. If everybody in Hertfordshire did these 4 things, we would really make a massive difference. And lots of people in Hertfordshire have done. Actually, we need to bear in mind that without the response of our residents, we would not have controlled the outbreak. Every single person who's been photographed for this campaign is a Hertfordshire resident. It's had, I think, a couple of million hits on social media. You can see it's in places from, so that's Hertford railway station, it's on bus and station signs, it's going on refuse vehicles, fire engines, buses, social media, libraries. We've had GPs doing things, we've been on community radio. Our press colleagues have been extremely proactive in getting things in media for us. And you can see we've dotted the county with coverage of these ad coverage, and our communication people have done a great job. Recently, we've focused on test and trace, support for businesses, face coverings, a lot of work on back to school preparedness. Upcoming work is on care home reassurance and winter health and housing, but we've done significant work to prepare schools. I have to say the University, the Royal Veterinary College and the colleges have been amazing. They've had groups meeting for some considerable time, and we have employed a full-time infection control nurse, as well as environmental health officer support, just to work with the college and university sector in Hertfordshire. And this is just an example of some of the further play your part messages around the county. I think I can skip the rest, Chair, if I may, and people can read it, other than to just talk people through the contact tracing algorithm, because I mentioned that contact tracing is something we're doing much more of. So I'll finish on just saying that in terms of local contact tracing, this is a nice, simple little flowchart. So you start in the purple bit on the left-hand side, and this is a national process. And if the cases are not reached within 24 hours, you go into the yellow box, and then a listing in a thing called Power BI, which is a program with a very secure program with the individual details of every single person with COVID in the county sent to us. We transfer it, we task the call centre that we're currently standing up and task the environmental health officers to do contact tracing. There are local phone numbers. So the gold standard for us is personal contact by telephone with a live voice, a human being at the end of the call from a local phone number. And if we can't reach them personally, then we will go out and we will visit. We will actually do house visits and door knock. We will take a letter in English and in the community language we think we speak. This has piloted very successfully in Watford. When we had the rise in the outbreaks in Watford, Watford did an absolutely fantastic and amazing job. We're kind of stepping it up in Dacorum and Hertfordshire as we speak. which is why you've got the Decorum logo there, because this was presented to Decorum members last week. And our aim is to ensure that we reach every case. And in fact, what we know is that where we have done this, we have got our completion rate up, and we've also gleaned information that is difficult, I think, for national to get. So we've picked up local nuances that the national don't, and we've got a link to language line, so we can do the contact tracing in the language of the person if needs be. Finish on the point of waves. COVID comes, as we all know, in multiple waves. So the first wave has been the immediate death and disease caused by the virus or as a result of it. The second wave will be the impact of people who've lost non-urgent appointments and whose health has deteriorated as a result. So that will take us a good year beyond COVID. The third wave will be the wave of interrupted care on chronic conditions. So we will have a number of people who have perhaps lost muscle tone or lost health because of lockdown, and then the fourth wave will be the psychological illness, mental health, economic injury and burnout. So we will be responding to this for some considerable time. At the minute, we're on a dual footing, which is doing everything we can to combat the virus, but actually looking at what we can do to maintain the health status of the public as well. And if I may, I'll finish there, Chair, and thanks for your time.
Thank you, Jim. As you can see, there's a massive amount of work. I've got an echo now. Questions, Caroline?
Thank you very much, Chair. Firstly, thank you very much to you, Jim, and to all your officers. I know you've been working extremely hard, and I think you've done a really tremendous job under very challenging circumstances. I think your comms have been excellent. The letter that you sent out this week to schools, I know was really well received, and I've seen your posters everywhere. So thank you very much for all the work you've been doing. I am a representative, as I said at the beginning, for Watling Division, and Hertfordshire falls. I fall within Hertfordshire, where we've obviously had a very high prevalence. I've had a lot of very nervous constituents, residents contact me, nervous parents, and I did actually raise this matter at the education panel on Tuesday, but I understand quite a lot of this will merge into this specific committee. And I just wanted to talk to you really about the school and the bubbles, because I was wondering what your thoughts were on two items. Firstly, that a bubble in a senior school of being the whole year, which is sometimes up to 150 pupils, seems very large to me, from the respect of the impact that it would have on, the parents of those children who would have to be quarantined if one person came down with COVID. And it just seems to me like a very large number. So I was just wondering if you had any thoughts on the sizes of the bubbles in senior schools, because obviously this is going to be massively affecting us in Hertfordshire. And the other issue I wanted to raise, and I wondered if you had any thoughts on it, were I've had a lot of people contacting me asking the question of why is it that if somebody within that bubble was infected, the whole bubble would be quarantined, but the other siblings from the household would still be permitted to go back into the school environment? Is that not the case? Tim's shaking his head, so he's saying maybe that's not the case. Would be permitted to go back into the school environment and potentially get us into a situation where a whole other year group or class, if it was in primary, would be quarantined. So I'd be very interested to hear your views, but more specifically on the size of the bubbles specifically impacting us at the moment in Hertfordshire. Thank you very much, Chair.
Thank you. Firstly, thank you very much for those kind remarks. I mean, I think I am richly blessed with the team I've got, and I think the setup in Hertfordshire, and I know that people say that we're really working together well as a group of agencies. I wonder, Chair, if it might be better for Sue Matthews, while she's still with us, to answer those, because Sue leads on our schools cell, and also just to note that we'll be writing again to parents next week when the government guidance changes, just to kind of make it clear. I wonder, Chair, if Sue can answer that if she's still with us.
Yeah, by all means.
Thank you. Caroline, the first question is something that we were talking about yesterday, because I think a number of people are in agreement with the concern. We have a couple of people working on a risk assessment tool for secondary schools. I think the issue is more for year 10 and above, because once students take options, they move around a lot more than maybe the kind of younger secondary school age. So what we are promoting among secondary schools is for them to develop seating plans. Now, I know that a number of schools are already doing this, but we're going to encourage all schools to do that. And then we will develop a risk assessment tool, and it should be done, we should have a draft today, where we can then do a much more detailed risk assessment among that case, so we can work out who they've been sitting around, who their friends are, who they're in contact with, so that we won't then have to isolate a whole year group, which can be in the hundreds. So we are addressing that issue.
Is it also fair to say that we may be also revising and simplifying guidance on face coverings and one or two other things at some point, because as the numbers are going up, we're going to be clearer about standards and preventing spread.
Yeah, we talked about that, Jim. That's partly why I was late on the call, sorry. But we are going to, as Jim said, we're going to review the letter for next week, and face coverings will be reviewed. But I think it's we just need to kind of make sure that we get it right. Really, we don't want to
I may have misunderstood the second part of Caroline's question, but there was a part about siblings and if young people are sent home from school.
So the national guidance, Caroline's absolutely right. The national guidance is if a child is in the bubble and is a case, that bubble will self-isolate, but the family of that contact will not self-isolate. The family of the case would self-isolate, but not the contacts, and that is national guidance. And I think that there are valid reasons around that. I think until that if that child develops that close contact develops symptoms, then obviously that household would need to self-isolate, but that is national guidance.
Thank you. I mean, it seems to me that we learn about this as we go along to some extent, and as a consequence, I think some of the direction is arguably somewhat anomalous. But I think we need to keep a very close eye on that situation and act appropriately if issues arise. Are you happy with that, Caroline?
Yeah, thank you very much. I appreciate your answer. And if you do have the opportunity to lobby, actually, on my second point, I do find it quite strange that somebody who's been in a classroom would be in closer contact with somebody than who's lived in the same household. So I think that might be a point, Jim, when you next speak to the powers that be, might be an interesting one to raise. Just my opinion. But thank you very much, both of you, for your answer. Much appreciated.
Chair, in response to Caroline, I'm very happy to raise that in my next meeting with the Chief Medical Officer, because I've already asked for infographics to be produced of all guidance, and our own schools cell is producing a risk assessment and a range of other tools, including infographics, because we need to get these done. So rest assured, I'll raise it.
Thank you.
Next question from Nigel Quinton.
Thank you, Chair. Yes, I mean, actually, I just want to comment on the last issue because my local secondary school has had a case, and Year 8 have been sent home, and I had very similar communications from local people to the ones Caroline was describing, expressing confusion about the whether they all should be self-isolating or not. I mean, and really, I think that comes back to the question I really wanted to ask, which is about testing capacity and the effectiveness of the contact tracing. Tim, you'll recall at full council I asked about where we were in Hertfordshire, and although I did get a response, it was more of a national response than a local one on the success or otherwise of completing our contact tracing. And things have moved on obviously since then. So I'm going to ask the same question again, and hopefully we'll get some data on this. I mean, testing capacity is a real issue right now, and I've got a number of people reporting to me locally that despite the fact we've got a massive centre in Shire Park in Welwyn Garden City, and despite Jim telling me yesterday that there was capacity there clearly isn't, and people have driven up and been sent away. I know this is a very complicated situation that reflects national laboratory capacity as much as necessarily the actual testing capacity, but it's becoming a very significant issue for a number of people, particularly as cases rise. So if Jim could comment a little bit on where we are with that and what we can do locally to counter the ineptitude of government, that would be much appreciated. The other things I just wanted to mention were on the contact tracing, with this sort of double system of going from national down to local, having waited 24 hours for them to try to sort it nationally. How important is that delay? Does that make a big difference in the effectiveness of the process, or is it something we can live with quite happily? And are we getting all the data for access that we need from central government? I know that there was something in the report which I can't find right now which suggested that was still something we were working on. And lastly, are we doing a huge amount of work here? Hats off to the fantastic work that Jim and his team and the boroughs and districts are doing as well on contact tracing. Is there sufficient resource to support that effort? And if not, what are we doing about it? And sorry, and there was one last point, and that was on the drive-through centres. I had a question yesterday from a resident who lives within sight of the centre at Shire Park in Welwyn Garden, but can't access it because she doesn't drive. And so it obviously raises quite a lot of equality issues there. That's it.
Over to you.
Right, I think there's 4 there, so I'll if I miss anything, I'll do my best. In terms of drive-through, actually in Watford we set up drive-through and non-drive-through mobile testing sites. So we've got Welwyn Garden City, Hertford, Hemel, Watford, Apsley. We've also got testing capacity at Stevenage, and we have a contracted service. We've got the postal testing service, and we've got a contracted service provided by the NHS to go into care homes, and in some cases, and Sue might correct me if this is wrong, because things change every 5 minutes, schools, if need to be, to do outbreaks. We are still arranging transport for people who can't get transport, and particularly in Watford, we had a non-drive-through option. So access is really key for me. I would like a non-drive-through option at Welwyn Garden City, but these things are kind of dictated nationally, so we're still working with them. I think the problem with testing capacity is that the national system is trying to stand up so much that actually we could provide a lot more local intelligence and really work with them to make it work. I think there are lab issues that we all know that we're still advocating on, and testing is important. So we've done and are doing everything we can to stand up testing locally, which is why from Monday we'll be standing up key worker testing, which we will locally commission. But there are a number of national issues that I think really need national action. So all I can say is that on a daily basis, we're still working on this and trying to find ways around it, and we'll keep it. And actually, I welcome people telling me there are concerns, because I can go there with people. Last week, I intervened to get a 90-year-old man a test to stop him having to drive some way. So, and I do know that there's capacity, because I am sneaky enough to go out and visit the places, or indeed send other people round. So we keep a very close eye on testing issues in Hertfordshire, because it's important to us. in terms of resources, I think we're all right for resources at the minute. In terms of finance, I think the challenge we have is environmental health officers are flat out. There's not that many of them. I think as a nation we have not invested in environmental health as much as we could have, I think. So we started bringing in infection control nurses and others. So we have been lucky in that we've been very inventive, and we've had really good partners who've worked with us on resourcing. So for the present minute, I think we're all right. I think the big issue will be whether for care homes we see the infection control fund continued and the DHSC supply of PPE, and if that comes good. I think the other thing in terms of resourcing is that the national system on care home testing has stood up again and is ramping up again. But we, you know, on a daily basis, I kind of look at that to make sure it's doing what we want it to do, because we do want to get to the weekly and care home staff testing, and we do want to get to the monthly resident testing. And while that is happening in some places across the country, it's not happening everywhere, and we are still on it. In terms of contact, I hope I'm answering all your questions. In terms of contact tracing, the 24-hour delay is actually shorter than the number of other areas in the country, so we take that off, and we've been quite proactive in that. Sue will correct me if I've got this wrong. And when I looked at our contact tracing completion figures yesterday, in Hertfordshire we got up to about 91%, which is good. It's gone up rather than down. It did dip, which is why we put in this new system. We're procuring a new IT system for it, because the one thing we don't yet have access to, like many places, is a thing called CTAS, which is a national system. I think CTAS is going live on the 14th in one part of our county for us, but we'd like it everywhere, so we're still at. But what we've done is we've done a workaround. So the information comes in on a system called Power BI. It is then cleaned, deduplicated by our information team, then loaded onto a system. But as of the next couple of weeks, we will have a system called Microsoft Dynamics and a server and an extranet that people can log into securely, which will mean that it cuts out quite a lot of work and people can get access to data. So particularly environmental health officers. So we will speed that up significantly in Hertfordshire. And we're just doing that because we can, and because we've got a solution and we can do it. And that will work. I think that for me, National Test and Trace still needs to double down on asking contacts for their place of work consistently, their workplace and their employment absolutely consistently. That is, I think, a priority that we want National to highlight. So I think we're throwing everything at this, and we're seen as rather persistent. Hopefully, I've answered your questions.
Thank you, Jim.
If I could, Chair, just come back on one point.
There are other people, Nigel.
I'm aware of that, Tim. But just very briefly, and it's just to follow up on what Jim said on the local access at Shire Park. I mean, I think they've got wise to what Jim and others have been doing in advising people. The 119 is now clearly sending people back to the website, which I don't think they were a few days ago, and saying we can't do anything for you directly. And the as I said, the people at Shire Park are not allowing people to just turn up, which they were, again, only just a few days ago. So just so you're aware, Jim.
Thank you. Ron Tyndall, I think you got a question.
Thanks, Tim. Jim, I see the testing, and I'm looking particularly at your chart on 111 of your report, as one half of the coin, with the other half being when you get the results back, because just testing without getting the results back in time is basically, just doesn't sort of do any good, does it? So I just wondered, is there any delay in getting the results back, and what's the feeling through national and local on how soon that you can then react to the results? That's my first question. And the second one is basically the RAG rating on 114. I think this is really what Nigel was referring to. You've got you've got data sharing agreement now in place and signed, but you're awaiting access to data as part of the local protocol. And I wondered if you could update the situation there. That's my two, Tim.
Okay, so Sue will correct me again if I get this wrong, but in terms of test results, we are getting results back in some cases as quickly as 24 hours, and the upper limit is 72 hours, and it has kind of oscillated locally and nationally along those lines for some considerable time, largely because of lab capacity. And those are situations that are just out of our hands, unfortunately. Our swabbing service that we commission tends to get the results quite quickly, and quicker than that. If I were to suggest I think there's three big improvements that could be made to the system nationally that have been widely and publicly reported. The first is lab capacity, which Sarah Jane Marsh said she was aware of earlier this week. I think the second is the logistics of getting results to and from laboratories, so networks of local laboratories. And I think the third is the communication of those results back electronically into a number of systems at once and not just one system. None of which is in our control. It's all in the control of the agencies running the system. But we do have a swabbing cell, and one of the reasons we've been able to augment, improve, bypass and deliver in Hertfordshire some of the stuff we have is because that joint swabbing cell between public health and the NHS has been working, and so that's the cell that's decided we'll step up key worker testing as of next week. The issue of data, so there is a program called CTAS, which is a contact tracing access system. Wee bit clunky, but it works. I think there's an issue about having access to that. Key worker is, so we're looking at teachers, social care, other frontline workers, there is a case definition that we've had, and that's being stood up, but it's not just health and care, it's other frontline key workers, including teachers, and I think infrastructure workers as well. Was on the last definition, but the swabbing cell is currently looking at what we can actually deliver.
Jim, would you just clarify for my benefit and others I hope, you should, my understanding is you should only go to get tested if you're symptomatic.
Currently, yes.
Regardless of the outcome of that test, you should isolate for a period.
Yes, so there has been a bit of confusion. So it was reported by our NHS colleagues that parents are taking their children to children's emergency department with mild COVID symptoms, fever and various other things, not warranting hospitalisation. But actually they were testing, some of the parents were testing negative, and they were still going about the business. So if you're self-isolating, even if you test negative during that self-isolating period, for the vast majority of situations, there are exceptions. Your self-isolation period runs until your self-isolation period finishes, if you're asymptomatic.
On the question of key workers, Are waste operatives considered key workers? I must admit, I'd only just thought of that, because it seems to me that collecting household waste on the regular system is a health it's an health issue as well as anything else, isn't it?
To be honest, for the team that we're standing up as of next week, I don't yet know, because I haven't seen the case definition. But they were previously. So yeah. I can't answer that one way or the other. I will go and find out.
Yeah.
Thank you, Jim. Thank you, Jim. Anthony Rowlands.
Thank you very much indeed. And I echo Caroline's opening praise for Jim and for his colleagues, and I hope he'll pass it on. It's how it felt, I'm sure, from all of us. Two questions, slightly different issues. One is, Jim, I mean, without going into the details, clearly there's a lot of concern about, as it were, young people engaged in risky activity. I wonder whether there is any evidence from other areas where they've had earlier spikes, as it were, in terms of what are the most effective ways of trying to influence young people positively to recognise what might be risky. That's the first one. And the second question, I mean, we're a public health panel. We've had lots of discussions and conversations about types of exercise that people should be taking. I actually participated in, I think it was the first main sort of running race, 10K running race in Hertfordshire about 3 weeks ago, and it was phenomenally well organised by a private organisation. It was authorised. It was deeply impressive and clearly also enormously beneficial to a lot of people. There's a newspaper comment, obviously, about, for example, the recommencement of park runs, and there's a lot of those in Hertfordshire. And I'm just wondering what you think the most recent guidelines suggest in terms of whether we should be encouraging those events to take place or adopt a more restrictive approach. One can see there's a conundrum here in terms of a benefit that those events clearly have for hundreds and hundreds of people who participate.
Thank you. Can I deal with the events one first and the physical activity one first, and come back to the young people's one? Essentially, we want people to be doing physical activity. So having been locked out of my gym for several months and developed withdrawal symptoms and rediscovered my bicycle, I'm now kind of doing a mix of bicycling and gymming, and the gym is really good. They insist that you sanitize before you go in. You don't go in if you've got symptoms. Everybody's details are taken for contact tracing, and you clean the machine you use before and after you use it, which is perhaps a little bit over the top, but actually really, I think, good. I've worked with Parkrun and others because we had the trials, the speed trials earlier in the month, and I think they went off really well by and large. So we have proven, and there are a number of places that have got events going where we have proven that physical activity events can be organised safely. I think the first thing to say is that the law says that large events are illegal unless they're not illegal. And there are a series of exemptions. So things like faith communities, work events, organised sports events. And we want to work with people to make those safe. So the new county-wide safety advisory group that's been stood up, it exists to do just that. So we will work with every organiser. We don't want to take enforcement, and in fact, there have been several situations where we have said you either do this or we will enforce, and we have managed to do it by consent. So I would much rather people were proactive and come to us, because with Parkrun it got into, a very detailed discussion on how frequently they clean the toilets and no contact registration and stuff, and they had really done it well. There might be people who haven't got the level of organisation of Parkrun who can't do it as well. So come and talk to us. We will do our level best to, if it is safe in terms of the epidemiology in the background, to organise physical activity. we will help you. If it isn't, we will tell you it's not safe to go ahead, and we will be very clear about our views. Hopefully that answers. So we want people taking physical activity. What we don't want is large clumps of people all gathering together, breathing aerosol on one another in large groups. So that's a long answer. In terms of influencing young people, we're going live with another campaign this week with young people, and we're working with Hearts Youth Connections. We've got the behavioural sciences team working on it. What we do know is that young people have been quite significant in driving bits of the current outbreak. We mustn't blame them for that, because actually, it's natural for them to want to connect, and if you don't connect, you end up with mental health problems. So the information I have is that the best campaigns appeal to young people in terms of their care for others, because most of our young people are very strongly oriented to care for others, particularly older people, and that has had an impact, and that's what we're working on. We also need to work with parents, because actually, in response to the letter which we sent out, a number of parents have contacted me directly and said actually they had felt some peer pressure, and giving them that letter, they said, one mother said to me, it gave her the ability to refuse the peer pressure. So there's some stuff to do with parents and some stuff to do with younger people. I don't know if Sue wanted to add anything to that.
Sorry, it took me a while to get my camera on. I think, Jim, I think you've summed it up really well. I think from my involvement with Decorum a few weeks ago, I think I got a sense that young people were acting quite responsibly, actually. And I think Jim's right. I think it really is partly about being clear about what they should and shouldn't be doing, because there has been a bit of confusion around whether close contacts get tested or not. And I also think the local contact tracing will play quite a significant role, because we found it was very effective in terms of getting information from young people, which the NHS Test and Trace programme wasn't successful getting. But we are working very closely with YC Hearts and with young people to make sure that the messages are right.
Thank you. I've got 3 people waiting to ask questions. William Whitelow, Mark Mills Bishop and Lynn Chesterman. And after that, I intend to draw a line unless anybody has something which is urgently pertinent to the debate. I think we've given a pretty good airing. So next one, William Whitelow.
Thank you, Chair. I feel that we might be missing a trick. Obviously, Jim recognises the importance of vitamin D from the comment on the slide on the care homes. I think that we could take this far wider. Perhaps we should have business-oriented evidence packs which would encourage business on the benefits of vitamin D, and at the same time zinc and the other lifestyle factors which have been shown by quite a lot of studies to have an effect on one's likelihood of becoming a case in the first place. The second line is one of improving your chances if you do catch COVID-19, because again, the vitamin D has been shown to be very significant in mitigating the severity of a person's suffering, let's say.
So I think the first thing to say is I'm very happy to look into wider vitamin D. I think in line with Public Health England guidance, we would like everyone who's shielding to be taking that, particularly care homes. So I'm happy to take that away and go and work on it. So thank you for that. In terms of the hospital treatment, there is a commissioning guidance, and it was revised last week by the chief and sent out by the chief medical officer, which talks about the use of remdesivir, the use of dexamethasone. Actually, now other steroids as well for treatment, and I will go and check about the status of vitamin D and raise that. I think as we've gone on, the survival rate of people who've ended up in hospital has increased significantly. That means we need to do quite a lot of work on protecting the health of people in the community. So I will quite happily go away and look again at vitamin D and look at what we may need to do more on.
Okay, William.
If I might follow up, what I was commenting on in terms of the severity of the case only applied to people who had already got adequate levels of vitamin D in their blood. And to do that, you have to act on the prevention side, make sure that you're taking your vitamin D long before you get the COVID-19 in the first place. Whether it be 30 nanogram or 40 nanogram is a subject for debate, but
so there's an issue in
can we offer tests for anybody who wants to check their vitamin D levels effectively?
The short answer is I don't know about. I take your point about serum levels. The short answer is I don't know about offering tests. I suspect our NHS colleagues would find it an enormous burden, but it may be possible to do some things for priority populations. If I may, let me take it away and see what I can achieve.
Thank you, Jim.
Pleasure.
Thank you. Mark Mills Bishop.
Thank you, Mr. Chairman. I've only got one quick question, really, for Jim. Can I just say, though, I echo the comments made by Caroline. Some fantastic work being done across the whole of the county. It really does demonstrate what I would call not only a can-do but a will-do approach. So well done to all your staff. Particularly interested in what Sue was saying in relation to schools, and another hat I wear in relation to education. I'd be interested to know the outcome of the risk assessment for the year groups that she's been working on. The very quick question I have, Jim, is about the wider groups you were talking about. We've heard about care homes and we've heard about the liaison. Can I just touch on the question of Mount Prison in Bovington? Not only on COVID, but the wider public health prevention issues of prisoners at the Mount. And I just wonder, do we have a link? Do we have a liaison? Are we in contact? Because I understand that prisoners are more or less in their cells all day. Visits have commenced, all being limited. So there is another danger. But I just want to be reassured regarding Mount Prison. Thank you, Mr. Chair.
So again, I think Sue will correct me if I'm wrong, but we have a cell that does have a link to the Mount. We also have links into the Mount for smoking and other work, and we've been involved in a number of health protection issues in the Mount historically. We do contact them regularly to ask if they need any help, because NHS England is largely responsible, as are they, and they are doing all they can to prevent it. But I will take that back and do a double check to make sure that they're aware of what support we can offer in case they want any, if that's okay.
Okay, Mark.
Thank you. I am reassured. There are 1,000 prisoners.
Okay, thank you. And I'm going to give the final question to Lynn Chesterman. Thank you for your patience. Lynn?
Thank you, Chair. Just want to add my congratulations and thanks. One comment and two questions, if I may. The quick comment is with young people. I've just shared something in antisocial behaviour, and what came up was that, and I'm sure you know, but I'm just sharing my new knowledge, is that young people tend to It's Instagram and TikTok, which is something that we weren't quite sure of. I think people still think Facebook is good for young people. So just to get the word out there, just telling you what we learned from young people in case that helps with communication. The two questions I've got, the first one is about schools. We do have a primary school in Hatfield, apparently, who's have had to send year 6 home. I have a 6-year-old grandson also in Hatfield, so it rings true. And both parents are key workers. I just wondered, Jim, can you raise when you go to your higher authority, what happens for the parents of those children who are self-isolating? Because obviously if you've got a year 6 or a year 3, sorry, my one's in year 3, they can't be left alone on their own. And at the moment, there's no provision for those parents to get any support or help if they stay home. And obviously there's no childcare. So I just wondered if you could raise that. And my final question, you'll be pleased to know, is if you go into a restaurant or bar, those who are collecting data are all doing it in very different formats. So will there now be a pro forma, because a lot are relying on QR codes, and there's an awful lot of people who do not have phones who are able to scan the QR code. So I just wondered if we're doing something that will be more of a pro forma collection data. Thank you.
If I can do the first one second, if that makes sense. So the contact tracing will become a legal requirement as of next week, I understand, whereas it's very strong guidance, but we can't enforce it currently, but we can enforce it from next week. And not everybody has a queue. I mean, I do wonder why we used QI code technology, because it kind of practically become defunct before this. But anyway, that's just me being a Luddite. I am told that government is working on a gold standard, which will be taking details either by email or by filling in a form or by QI code. And there are 1 or 2 places in Hertfordshire, if you go in, I won't mention them, that but you know, the 1 or 2, like the cafe in one of the museums, where you can have a QI code and you haven't got a QI code, they make you fill a form in. So I think it needs to be a multiplicity of measures. There have been a number of people trying to sell us proprietary programs to give to every venue in the county, but when that begins to cost £3 million, you think to yourself, I'm not sure this would be a priority for funding. So I think it's a real challenge, but we will work on it, and if needs be, we'll develop our own system, working with venues and businesses. We develop our own system to make it easy for them, as easy as we can. In terms of the first question, I honestly don't know the answer to that. I don't know whether Sue does. Because
I have just emailed our school's IMT to ask that question. I might not get an answer for you right now, but it is a really good question. I've got a feeling there is no provision, but we will look into it.
Thank you. Thank you very much.
Okay, Lynn. Thank you, one and all. I think we've given this a really good airing, and I want to echo the thanks to Jim and his team. I mean, believe me, we've only just touched on the amount of work that's gone on this morning. There's a colossal amount of work going on throughout our county staff, our district colleagues, people in the fire service, police, and so on and so forth. So I'd like to thank them all. And I'd just like to conclude with the thought that actually whatever work we do, we're actually really, really reliant on the public playing their part. In truth, the solution lies with them. If they follow the guidelines, we will beat this. And we can point to various things already in the county which would demonstrate that works. I mean, Watford, for example, we had an outbreak Decorum, we've had one, both of which have seemed to have subsided. No doubt they'll come back in other forms, but it really is important that people play their part, and we all know that's difficult, isn't it? You know, we had several months of this now, and it's not easy for any of us. So thank you to Jim, thank you to everybody else that's involved, and thank you to the public. I think they're doing a grand job, really. Jim, I know it's your practice to stay with us throughout this meeting, but I know you've got plenty on at the moment. So if you need to go and do other things, I think we'll all understand. So thank you.
That's very kind of you, Chair. If I need to dip out, I will. Thank you very much indeed.
Okay. I'm now going to move back to my apologies to Sue. I know she needs to get away about 11:45 if we can, so I'm going to ask you to be brief with any questions you have with her. But Sue, thanks again for your patience, and over to you for children's healthy weight management, procurement rather.
Thank you. It's actually quite exciting to be talking about something that isn't COVID. So I'll just give you a quick run through because I know you've got the paper. So I think this is something that we're all quite proud of because, you know, we had over the last few years, we've had a very good, very effective weight management program for children and young people. But we wanted to improve it. I think we were very conscious that we wanted to increase the prevention aspect within the programme. We wanted to try and make it a bit more flexible because I think, you know, one specific programme model doesn't work for every family. So we've done a lot of work over the last few years, working very closely with families to develop a model. And we've also been successful in getting additional investment into this programme, which is really positive. Both CCGs have invested money into the programme. So we have a decent budget now. We went out to procurement. Do you know what? I can't even remember. To procurement, but we went out to procurement and we were very successful, very strong. Candidates, busybodies are our new provider, and they went live in September. So just to give you a really quick run through, the programme still includes the weight management programme for school-aged children, and it's been fine-tuned and developed to improve it. But the additional elements are there is a much stronger prevention focus, and a much more kind of range of different approaches to maximise contact with families. There's a universal support tier which any family can access, and that will be a mixture of webinars, information and advice, etc., which will be available to any family. We've also now got an early years component, which is really important because we do know that, you know, that is the key point where behaviour patterns are being set. And the early years component is using an evidence-based model based on the Henry programme. And we also now have a stepped approach because we recognise that some families, a 12-week programme doesn't quite work for them, or they're not quite ready for it. So we've got what we call a it's a kind of two meetings really with the provider, and it might be to address a single issue, might be fussy eating, it might be, you know, a specific challenge, or it might be you know, kind of to get people on the road to maybe going on to the 12-week program. So we're testing that, we're piloting it to see how it works, and that will be developed over the next few years with the provider based on how the, you know, families use it and how it works. So they're the kind of additional parts of the program. Obviously we've had to adapt the program due to COVID, and most of the work is online at the moment. The provider very quickly developed an online model back in March, and they have evaluated it, and we are kind of working with that programme at the moment. We recognise that that's not ideal, but I think it's much better to have a programme than no programme at all. And I think that's probably the main points really. I suppose the other point is that this is very much embedded in the wider whole systems approach to healthy weight. So this is a core component of that, and you have had papers on that previously. That's it from me. I'm quite happy to take questions.
Yeah, thank you, Sue. Ron Tyndall, you've got a question, I believe.
Thanks, Tim. Yeah, thanks, Sue, for that. I was very interested in your early years mention, because to me that's the key. If we don't get to these families from 0 to 5, then basically I believe the damage is done. And I think it's then a hard struggle for the children. So I just wonder, first of all, are we linked into the family centres, and are we actually making sure that everything's joined up as well as with schools? Because especially with early years, of course, the schools won't necessarily be involved. Secondly, on the point you made about online services, while I think possibly there may be some families at the lower end of the income social stream that may not be online, most people these days have a mobile phone. Are we looking at possibly providing something through mobile phones if we can't contact people face to face when they haven't got home computers?
Yeah, so in terms of the early years, we are absolutely connected with the family centre services. We're working very closely with them. That's a clear. They're a really clear partner within this, and that was kind of outlined in the specification. We were looking before COVID for those sessions to actually be held on family centre service sites, but and that that is the plan. But they are definitely part of it, and they would be making referrals as well. So that would be the health visiting or the family support service, but families can self-refer. And in terms of online and mobile phones will obviously be a point of contact for families. I think, yeah, absolutely. For the kind of one-off support, it could be face-to-face, online or telephone. I think they're very flexible about the kind of routes of access, because, as you say, we do need to maximise access to some families. I think it could go either way with the online access. I think for some families it could be a benefit because they haven't got to travel to a location, but for others it might be more of a challenge. So we just need to work through it.
Thank you. So we've got next, Nigel.
Thank you, Tim. Yeah, just a couple of points. Again, very much welcome this, and we've been pushing for more money to be spent in this area for a couple of years now, so that's great to see. And I just wanted quickly on the question of the financial side of this. I think I probably asked this before, to be honest, but is there any evidence, or have you got a means of assessing what the potential financial benefits are to the system as a whole for the investment at this stage? And then the other question I've got really is a bit of well, it's not parochial, it's half the county, but I noticed that the Henry is only being rolled out in the western part of the county at the moment. I'll assume we're working on ways to spread that across the whole county. How are we doing that, and by when are we hoping to have that across the whole county?
So in terms of the financial benefits, we did look into this as part of the business case that we developed to the CCGs. It is very difficult because there is evidence around the immediate impact for children and young people, but when you start to look at the kind of longer term benefits, as with everything, it becomes a little bit difficult to pin down. But there is definitely national evidence out there around the longer term benefits, yeah, I think that it is very clear, but it is very difficult to kind of pin it down into financial value and return on investment at a local level. So yeah, that's probably not a great answer, but it's the reality. But we are working very closely with the provider in terms of their KPIs to ensure that we can demonstrate benefit. And you know, they're very proactive to develop that, and we'll work with them over the next 3 years on that, because it is important to show, you know, what the outcomes are. But I think there is also evidence around mental health, etc. as well. It's not just about healthy weight. In terms of the Henry programme, the reason why the Henry programme is in one part of the county was mainly due to investment. Herts Valley's CCG were very keen to invest in it, and East and North Herts were quite keen to try a different approach. And I think the idea was that we could see the impact of Henry, we could look at the impact in East and North Herts, and then, you know, we could make a judgment on that. But I think my aim would be to get a county-wide provision, absolutely. But we are working on that.
Okay, so we're the control population.
Yeah.
I was going to say all the fit slim ones are on the east of the county, but I don't think I'll go quite that far. But just as an observation, I think, you know, there is a lot going on, and I think it's important that we don't just look at single initiatives in isolation. There's things like Healthy Walks, the work the Heart Sports Partnership are doing, various clubs around the county. There's a massive amount going on. And I feel very strongly that if we can coordinate that effectively, then we'll get a lot more bangs for our buck. So I wish you well with this programme, Sue, and you know, and everything else that's going on in the county, basically. I've got no one else lined up for a question. So unless anyone does, I'm going to move to the recommendation and ask that the panel notes the report. Are we content to do that? Thank you. There's a clear majority or unanimity, I think, to do that. So thank you very much. Can I also apologise for my faux pas at the end of Jim's presentation? I didn't ask for a vote on whether we noted or not. I've assumed we do. Are we all content with that? Thank you very much. I think that, as I'd hoped and expected. Thank you, Sue. Thank you very much. Now moving on to, where are we? Sustainable Hertfordshire, incorporating health and well-being into the county's council's sustainability and climate change strategy and action plan. Bethan, are you with us?
I am. Hold
Over to you.
Hello. Right.
Hello.
Right. Hello. So yes, I'm just bringing a paper to panel in advance of a more formal paper coming through in autumn from the head of sustainability. The reason for bringing this to you now is to kind of update where the sustainability work has got to, but also because I think there needs to be some consideration of how that work to date has incorporated health and well-being. So I am just going to attempt the technological wizardry of sharing my slides with you. If you just give me 2 seconds, we'll see if I can make it work. Right, can you all see that?
Yeah.
Excellent, excellent. Right, so the sustainable strategy, just a quick brief recap. That the council agreed to declare a climate emergency in July of last year, 2019. What followed was a commitment to undertake quite a lot of work around developing a strategic approach to sustainability and climate change. And this resulted in the Sustainable Hertfordshire strategy being adopted in March of this year, 2020. Since that point, all departments were asked to pull together an action plan, which supports the delivery of the strategy and the aims and objectives in that strategy. And these action plans have been worked on, they've been consolidated over the summer, and they'll be brought to all panels for consideration during autumn. So that's what's forthcoming. In terms of what the strategy has in it, the intention of the strategy was to pick up on the United Nations Sustainable Development Goals. As you can see, hopefully you can see from the slide, many of these have direct links to health and well-being, and all of them indirectly support health promotion and health protection. In terms of what the strategy actually says, it has two ambitions around being a leader in our own operations as a county council, and then also inspiring a sustainable community. Sitting underneath those are 9 objectives, if you will, and they're focusing around zero carbon, ready for the future climates, and being an environmental leader. And just to recap, that there is a very clear link between sustainability, climate change and health, and that's health at both population level all the way down to individuals. It's been recognised globally and nationally that the link is incredibly significant, and it represents a really big public health challenge. At the basic level, I think the point here is that a sustainable Hertfordshire, which is the aim of this strategy, a sustainable Hertfordshire requires a healthy population, and one that is resilient to the challenges of future climate change, and one that is able to respond positively to the changes needed to enable sustainable communities. And this has become even more relevant as a result of our experiences at the moment through the global pandemic and how we're moving into socio-economic recovery. So the question, therefore, is, given the importance that we need to place on healthy people, communities, and the sustainability and climate change context, does the Sustainable Hertfordshire strategy have health and wellbeing firmly embedded into it? It certainly has a strong environmental bias, and it very clearly states in the strategy itself that it only considers how we're meeting the environmental sustainable development goals as set out by the United Nations. It's intended to be a live document, a dynamic document, so it's not intended to be static. So there is an opportunity here to ask some questions around whether we feel the strategy sufficiently recognises the human pillar of sustainability, if you will, particularly people, and inequality, health and quality of life. In the course of pulling together the Public Health Action Plan over summer, it became quickly apparent that everything we do as a public health service contributes to sustainable communities. You know, that goes without saying. But actually, what I did find is that it's very difficult to align the work we do with the 9 objectives that's set out in the strategy. I have attempted to do it. I'm not expecting anyone to be able to read this, but this slide is very much intended to show how we're trying to capture all the various things that public health do just as a department on its own, jointly, collaboratively, corporately, and how they might start to meet and deliver the sustainability ambitions outlined in the strategy. I actually think there's a lot more that we're doing that it's difficult to put in this kind of table at the moment, and that's mainly because the strategy's ambitions are very environmentally focused. There are some really significant opportunities for building the health, people and community angle into the strategy in order to improve the ambitions and to perhaps enable it to have a more holistic approach. So just to work through these, public health is shifting its strategic focus to inequality and what that looks like for Hertfordshire. So there could be some really significant opportunities for shared work and co-benefits on the sustainability agenda as well. The health and wellbeing strategy is will be coming to an end. National guidance states that Health and Wellbeing Boards should be including sustainability and climate change in their strategies, and obviously now's a very good time in which to get this as part of their strategic review, and this is hopefully going to be on the agenda for the next Health and Wellbeing Board. And there are opportunities there to develop a work programme around any priorities that a future strategy might place on sustainability and climate change. More recently, the Centre for Public Scrutiny has approached local authorities with a series of questions to understand how they're responding to sustainability and climate change. 2 of these focus on health, and these are listed here. So what measures are being taken to ensure that health and social care systems will be resilient, and how does the council identify those who are most at risk, i.e. who are the most vulnerable communities from the impacts of climate change? I actually think that these questions are incredibly helpful, and that they can frame how we might wish to start to develop a broader agenda around health, sustainability and climate change, perhaps within the framework of the Health and Wellbeing Strategy. It's all up for discussion. But the main thing about these questions is that they identify gaps, and they can produce co-benefits in terms of joint work and collaborative work moving forwards. Believe it or not, in terms of the current global COVID pandemic, I think there are a number of opportunities coming out of that to learn and to apply our experiences to a different crisis, but a climate crisis nonetheless. There's a significant amount of learning already coming out globally, nationally and locally around place-based issues which directly link to sustainability and climate change, air quality, the importance of active travel, places, how we use them, access to quality open space, housing design and so on. What the pandemic has really done is shone a spotlight on inequality in health outcomes, however, the importance of prevention, and also the scale of change and transformation of services that has been needed at pace across the system. And what this shows us is that there is an awful lot that can be achieved in a crisis, and it's quite a useful blueprint to help us prepare for another crisis, and the climate crisis effectively. So I think there are some clear real opportunities for us to align a number of strategic priorities across services to better understand inequality, our vulnerable communities, our services, and how this all fits with climate risks at an individual and community health level. And more importantly, what we need to do to enable resilient and sustainable communities. So given all of that, the question to members at this point in time is there a view around pursuing a stronger emphasis in the Sustainable Hertfordshire work on health and wellbeing? And if there is an appetite to do so, the most appropriate ways in which to pursue this. Members may wish to consider approaching colleagues on the Sustainable Hearts Exec Member Board, for example, but I would welcome any discussion and views coming out of this. Thank you.
Thank you, Bethan. I think that's a really good paper and presentation, and a really challenging one, actually. And I think you're right to challenge us on this, and you raised some very important points, which I think we need to take on board. Any questions? Where have we got? Nigel.
Yeah, thanks, Chair. Yeah, definitely really good paper. Thanks very much indeed. It's very well expressed and raises a number of issues. I must admit, I was a bit confused as to where the sustainability strategy got to through lockdown, because I didn't attend Cabinet, and I'm not on the highways panel, and so hadn't actually seen anything about this, and it's not come up as far as I'm aware at any of the SCPs either. Apologies if I missed it. But if I remember rightly, when we went through the beginning of this process, I mean, every panel was consulted on ideas to feed into this. And I guess I'd assumed that this would either come back to panels or be discussed at full council before it was adopted. And I think that's maybe why it hasn't maybe had quite the breadth that it needs, and the input from your end of consideration. And I'm also, I mean, looking at the summaries that you provided, I think on your slide 4, you know, what's in it. And there's a lot of stuff about ambitions, but they're all very long way off in the future. They're 2030 and 2050. And I mean, I sat in on a discussion on a housing thing beginning of this week or last week, can't remember when, where I think it's a very good example, because this was a presentation, I think, being given by Savills to the social housing sector. And they were basically saying, well, because we've only got to achieve this by 2050, we've got plenty of time to do it. And any target that is more than a decade off, I think, is worthless. You have to have short-term targets, as was brought into the when we had the Climate Change Act, to make these things effective. You've got to set short-term targets, otherwise you just continually fall behind the curve. So that's just an overall comment on the sustainability strategy, and I really do hope it's genuinely a live document, and I hope we can tighten it up and make it more ambitious over the next few months. It is a really important subject, and we can't let COVID get in the way of it. And as you say, lots of opportunities to rethink the way we do things coming out of the COVID crisis. And on the basic question you've asked, yes, I really do think we should be trying to influence the direction of this and include more of the public health angle into the strategy. Thanks.
Nigel, in response, I can fairly confidently say that although COVID does get in the way of things, the ambition on this project is not diminished. Mm-hmm. And I don't think anybody in Hertfordshire is looking at 2050. I think we're looking a lot sooner than that, but no doubt more will come out in due course. Who have I got next on my list? Ron Tyndall, I think.
Thanks, Tim. Thanks, Betham. Very, very key. And I think you're right in stressing that public health should be embedded. Can I? You may have already started this, but the districts are appointing climate officers, not the lead officers, the senior corporate directors and people who have been charged with it, but the actual boots on, as Jim would say, boots on the ground, like yourself, at district level, to get on with it. And I just wondered whether or not you're actually starting to form a network amongst yourselves, the 11 officers, to actually share and work together to promote this sort of thing, so that we actually achieve something together, because I think a lot of this will have to be done in partnership.
Forgive me, Ron, where have you been? This has been going on for ages.
Yeah, no, I'm talking, well, Decorum have only just recently appointed their climate officer.
Okay.
So what I'm talking about is the implementation. Districts have been doing the predictions and what they've been wanting to do and generally setting the scene, but we're now getting down to the nitty gritty, and it's a question, I think, of liaison between the officers who are actually doing the work.
Well, I think that's right. I mean, a point I would make, of course, is that districts and even the county are not in this game on their own. It's a much bigger game than that. We need to be liaising with all sorts of different people.
Yeah,
I think we are. Bethan, did you want to comment on that?
Yeah, I mean, obviously we have appointed our own head of sustainability, that's Julie Greaves, and she will be coming to panel in autumn, so these kind of questions can be put to her. But yes, she is pulling a network together, and they've also created a Hertfordshire Climate Change Board partnership, as well, where that network is going to exist and be hopefully expanded beyond local authorities to pull in other parts of the system as well.
Lovely, thanks very much.
All right. I don't think I have any questions. Anybody else want to ask a question? Can I take it in that case that we're all happy to note the paper and endorse the direction of travel? Can you just please Again, high levels of unanimity, for which I'm very grateful. Bethan, thanks very much for that.
Thank you.
I'm speaking at an LGA webinar next week, and I'm going to plagiarise all your notes speech.
Well, let me know if you need anything else.
Thank you very much. Right, moving on. Future work programme. Panel's invited to note the programme. Has that been circulated? Alison, can you help me on this one?
I haven't seen anything, Tim.
Right. Alison, are you with us?
Yes, Tim, I am. No, it hasn't been circulated yet.
Okay. In that case, we need to circulate that and move it forward. Our next meeting is on the 14th of October. So if anyone has any comments on that when they receive it, if they could let me know. There was no other part one business. So that concludes our business for this morning. Thank you very much for your attendance and your participation. And see you on the 14th of October. Thank you.
Thank you, Tim.
Thank you, Chair.
Thank you. Bye-bye.
Thank you.
Thanks, Tim. Bye.
Bye.